Hi, I'm Jennifer Allen reporting for RSNA News. I'm talking with Dr. Yulei Jiang, Associate Professor in the Department of Radiology at the University of Chicago, and Dr. Gillian Newstead, Retired Professor in the Department of Radiology at the University of Chicago. We're talking about the potential of artificial intelligence to aid breast cancer screening. Dr. Jiang, I'm going to start with you. In your radiology study, how did the use of an advanced AI system improve a radiologist's ability to differentiate benign and malignant enhancing lesions detected at breast MRI?
Yeah, so in this study, we have the AI system that made available to radiologists. They basically selected the seed point to indicate the lesion, and then the system takes over, segment out the lesion, and provide a variety of information to aid the radiologist, such as a score indicating whether the lesion is likely to be cancer, and similar images from known diagnoses. So the result of the study is that the area under the ROC improved with statistical significance, and there's a slight increase in sensitivity, about 4 or 5 points, depending on the bite-rise category we use to deciding sensitivity. There is no increase in false positives. So these results are promising, showing that the AI system helped the radiologist to be more accurate in differentiating cancer versus non-cancer lesions on breast MRI.
Dr. Newstead, what could the addition of AI do for a breast imager's workload?
Well, I think this is a very important question. Mounting clinical demands have placed stress on radiologists. They're overwhelmed with cases, even though they're at maximum interpretive efficiency. And volume burden has increased in tandem with utilization, so that not only are there more cases for radiologists to review and interpret, but there are increasing numbers of images per case because of technical advances in breast image resolution. Radiologists are reading larger and larger number of images in shorter and shorter time frame. AI tools that can help radiologists by eliminating some mundane tasks could greatly improve radiologists' workflow. Embracing AI technology can improve efficiency by removing, for example, 10% of time-consuming, intensive, dull tasks from radiologists' workflow. AI could therefore yield greater satisfaction for interpretive work by allowing radiologists to focus their attention on the most suspicious or difficult cases. So that's important, I think. If radiologists were provided with software that could classify images according to probability of malignancy, then they could spend less time on those with lower suspicion, lower lesions, and pay more attention to those with a higher probability. Software could decrease the radiologist's workload, reduce false positive recalls, and increase cancer detection. Also, I think another aspect would be AI that could be useful for targeting administrative functions in radiology, such as turnaround time. AI could be able to improve efficiency by prioritization of cases and improve patient scheduling. An example of this type of efficiency might yield improved and fast delivery of reporting for referring physicians, which is an important thing, and efficiency might yield improved and fast delivery of patient follow-up needs. Emphasis on improved imaging services and more clinical interaction between referring physicians, radiologists, and patients could be helpful with AI, and that I think is important as well. As the landscape of healthcare continues to shift towards value-based care, the use of AI tools for image interpretation and improved administrative functions may represent a feasible solution for the many challenges facing radiologists, including the risk of burnout and diagnostic errors.
Dr. Jiang, what is the hope or expectation for AI in diagnostics for breast imaging?
So the first expectation, we're hoping that this finding that we see in this study gets replicated in the clinical practice. So we're hoping the radiologist performance will improve. Specifically, we're hoping to see the 4 or 5 point increase in sensitivity without a penalty in increase in false positives. From a more practical reading point of view, we're hoping that the various tools that the AI system provide to radiologists will be resources to radiologists in different aspects. Hopefully these tools would help radiologists make better decisions. And if not, they would increase confidence for radiologists when they read the cases and make their diagnoses. Hopefully that would be helpful to radiologists. Of course, over time, we hope the AI system would improve, and hopefully that would bring on more help to radiologists.
Dr. Newstead, how will AI benefit regions, especially rural ones, where there is a shortage of breast imaging specialists?
Good question. I think for the foreseeable future, AI will be deployed in radiology, and we will simply change how we work. An AI system could help radiologists to be more accurate when making diagnosis of cancer versus non-cancer on breast MRI. Many regions, especially rural ones, have a shortage of breast imaging specialists, and once sufficiently validated, AI algorithms will become an integral part of screening and diagnostics for breast imaging, not only for MRI, but also for other methods such as mammography screening, etc. Errors can be caused by cognitive biases due to quick interpretation, fast reading, and may increase rates of inter-observer and intra-observer variation, even among trained breast specialists. By combining both AI and radiologist interpretive assessment, predictive accuracy is improved when compared to human interpretation alone. AI will emerge as a second reader, providing a safety net that reduces diagnostic errors. AI will assist the essential component of radiologist interpretation, yielding reliability and accuracy.
Thank you both for your time today.
Thank you.
Read the radiology study mentioned, visit rsna.org/radiology. And for more radiology news, visit rsna.org/news.